We're all about facts, remember that, not fear, and providing you information to keep you and your loved ones safe. Through it all, we've had our own warrior, Dr. Payal Kohli, and she joins us live. I miss her. I love her. She's been wonderful to answer your questions about the coronavirus. So I want to start, Dr. Kohli, with the latest headlines. So hospitals, dire conditions. Tell me, not just in Italy, but all over. Before we get to the question, I want to point out what exactly nurses and doctors are going through. So we have a tweet, Dr. Kohli, from a nurse that's going viral, no pun intended. It says, quote, "This is the face of someone who just spent 9 hours in personal protective equipment, moving critically ill COVID-19 patients around. I feel broken, and we are only at the start." More nurses are replying to her tweet with selfies of themselves after long shifts. You're going to see a lot of these. Dr. Kohli, can you first explain why a mask and gown shortage is such a big deal? And then let us know, the entire DBL Nation, I'm looking at you guys, how can we donate safely any extra masks?
Yes, Tori. So thank you so much for sharing that tweet, because it's one of the most important things we need to be talking about right now. And our experience in Italy has actually shown us that if we don't have the masks, the gowns, the goggles, the protective equipment that we need, our mortality rate will be like their mortality rate, which is actually 9%. So almost triple of what it was. And as you saw in the pictures there, the personal protective equipment being reused, meaning wearing the same mask all day long, you can imagine the humidity that builds up inside the mask, inside the gown. You know, people are sweating, and that increases the risk to the healthcare worker, but also to the patients that they're caring for. So this practice that we're having to adopt of having to reuse our personal protective equipment not only increases risk to ourselves, but also to the patients that we're treating, because we could be taking infection from one room to the next.
Man, stay hydrated. Please, doctors, nurses, please take time to drink.
Yes, definitely. All right, Doc, I'm just going to ask you this because, I mean, we all know that some of us will not have masks. So what other ways can we help out doctors and nurses?
So I think the most important way to do so is the first step is to stay home, as we keep saying, because if you're not getting the infection, you're staying out of the hospital, that's going to decompress the system. The other thing along those same lines that you can do is actually to cancel elective visits. So I know a lot of people want to come in and check in with their doctor, but now is not the time to do anything elective. And then the final thing, which a lot of people are doing, and that's the silver lining that I want to share for today, is the community coming together and actually working on sewing masks and personal protective equipment for physicians. Now, there is some debate in the scientific community about how effective cloth masks are, but we do know one thing for sure, that they're more effective than having nothing at all.
Yeah, that's important. I put on my Instagram, please go to it, a PDF. It's free on how to sew a mask. If you're a seamstress or seamster or your costumer, it's really important. I know Hollywood, all the costumers are going together to sew masks, as well as Christian Siriano. Another headline, doctor, is Rudy Gobert, one of the first NBA players to test positive for COVID-19, is now saying his symptoms include loss of smell and taste for as long as 4 days. Is this something new, or is this something we knew could happen?
No, in fact, we're just learning this today. So the head of the British Rhinological Society, which is the Nose Society of England, actually issued a statement over the weekend explaining what does this. Now, we've all experienced loss of taste and loss of smell when we have a cold. But the interesting thing with COVID-19 is that you can actually have a loss of these as the first manifestation of the virus. So even before you have that nasal congestion, before you have any other symptoms. And some of the studies are showing that up to 1/3 to 2/3 of people will actually present with this as either their only symptom or as their first symptom. So the guidance is really, if you do experience a loss of taste or smell, assume you have the COVID infection and isolate yourself.
Wow. Thanks, Doc. I'm going to jump in right now because we want to get to our viewer questions. We really appreciate them, guys. Keep them coming. Keep them coming. Brenda asks, do I need to be washing my hair every day? It's a good question.
Yeah, that is good.
So great question. So hair is one of those soft surfaces that we don't know how long virus sticks on, and it's different whether it's attached to your head or it's on a surface. It's probably longer if it's sitting on a surface. But it's also, depending on the length of your hair, something that can touch other surfaces and get contaminated. So I would say if you're in a high-risk setting, like you're a healthcare worker or you're still going to work every day, then you probably should be washing your hair every day.
Okay,
but if you've been mostly home, then I think it's probably okay to do the usual.
Okay, that's good. Rich is wondering, can he contract the coronavirus at the gas pump?
I wondered that too.
That's me too.
Absolutely, because you're touching that plastic. And remember what we talked about on plastic, it can last for up to 3 days. So if somebody sneezes or coughs in their hand, pumps their gas, and then you come 5 minutes later, touch that plastic, and then rub your nose, you can absolutely catch that.
Wow, that's amazing. All right, guys, well, keep writing in. We got you on Facebook. We got you on YouTube. Dr. Kohli is standing by. Thank you for being here, and thanks for being a spokesperson for all our hardworking nurses and doctors. It is not easy, and we cannot give enough thanks. With our gratitude, thank you, Dr. Kohli. Now, if you want more information about the coronavirus, go to cdc.gov or the World Health Organization's website. And remember, what do I always say? No panic, right?
That's right.
I do this weird shrug
I do have a
thing.
question. Does Dr. Kohli know that the show's adopted her?
She's like part
she's
of
our
it.
doctor now.
Is she still on? Oh,
she
good.
can still hear us. Yeah, she's ours.
Oh,
you can't go
man.
anywhere.
That's